Welcome to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. In part one of our interview with Dana Kuhn, you heard how a single-factor infusion in 1983 set Dana's life on a path shaped by survival, stigma, and devastating loss, and how grief eventually became fuel. Today in part two, we follow what happened next, how Dana's relentless advocacy helped force a national reckoning over blood safety, how that pressure contributed to real infrastructure and oversight, and why Dana is stepping back into this fight now. Because the guardrails built from tragedy can be weakened faster than people realize. For Dana, blood safety is a promise we either keep or we break.
Well, after moving to Richmond, Virginia with the children and helping them emotionally and my parents helping us emotionally and mentally go through all this transition and learning how to live with all of this, I ended up getting the job in the hospital as a clinical counselor. And I was counseling people with HIV/AIDS and people with hemophilia who had turned HIV positive. Who better than to identify and empathize and counsel people with HIV than someone who's been through it himself? It was all kept discreet, and no one revealed that because, again, it was at a time that most people were being discriminated against.
Dana is naming something that defined that era. You weren't just managing a diagnosis. You were managing how the world might treat you if they found out. In the late 80s and early 90s, people living with HIV were still being refused jobs, isolated in schools, and treated like a threat instead of a human being. And for families in the bleeding disorders community, the stigma could attach to everyone: spouses, kids, even caregivers. So Dana did counseling work inside a quiet reality. You help people survive while trying not to become a target. And then a box of documents changed everything.
But the turning point for me is when I went to work there, Dr. Lyman Fisher, who was a pathologist, but he was the hematologist too for the clinic there for hemophilia, he was a pack rat. He kept every document imaginable, everyone. And so he said, I have this box I'm going to bring over to your office, and I want you to learn everything you can. He was my boss, and he said, learn everything you can about this. And here are all memos and things that came from NHF and came from CDC, and read them and learn about them. It might help you with your counseling of people with HIV. And as I started to spend time putting them in order and documenting them, I was looking at a sequence here, but there was surveillance study that was put out by the CDC and NHF in 1982, and they were collecting blood samples and they were testing for HTLV3, which is the beginning or what they first called HIV, lab results, lab markers, everything. And I saw that survey.
This was a survey conducted in 1982, shortly before his accident and consequential transfusion, leaving him with HIV, which led to the death of his wife. From this box, Dana expected education, material that might help him support patients emotionally. Instead, he found the beginning of a timeline, a pattern, signals that suggested concern existed earlier than many families were ever told, and that what happened to the bleeding disorders community wasn't just bad luck. It was a system making decisions while people paid the price.
And I started to get a fire inside me and thinking this should never have happened. What were people thinking? What were people doing? Were they ignoring the signs of what was going on? And that's when I became angry at things. I had to get myself calm. I think, not to lose it. So believe it or not, I just started praying about things, and I said, I've lost what I love to do, ministry. And I said, okay, God, that doesn't seem fair in my life of all the things that happened in my children's life. And now I'm looking at this, and it was basically something came to me and said, well, you got a new mission here. I had a fire in my belly, and I had to figure out who knew what when. And I need to get down to the bottom of this.
As Dana got closer and closer to the sources of the information, he understood the conflict of interest concerning organizations like the National Hemophilia Foundation. Dana was associated with the NHF through his work helping HIV-infected hemophilia patients. Knowing that he couldn't necessarily call them out yet and expect help from them, he began looking outside to other activists who were on their own paths getting to the bottom of what had happened. That's when he learned about a professor named Michael Rosenberg in California. Michael had a newsletter that he was putting out about hemophilia and HIV and was also questioning who knew what and when, and outright accusing the NHF of what they did and didn't know. So Dana decided to give him a call.
He was a little hesitant to talk to me because he thought I was from the National Hemophilia Foundation. I said, no, I work at a treatment center. I am involved with NHF and helping people and counseling people through HIV infections. But I said, I'm seeing things that I don't like to see here, and I need to talk to someone about it because I think someone did something wrong. And so he and I became close friends, and we shared documents, and he challenged me to petition the government for Freedom of Information Act. And I was asking CDC, FDA, Public Health System, HHS, everybody for documents as I learned about them. That's when I came to a place where I had them sitting all out on my living room floor, all of these documents.
And this is the moment where advocacy turned into an investigation. Dana wasn't only grieving, he was building a case. But Dana was also battling severe hepatitis C, another consequence many families in the bleeding disorders community know too well. And in 1991, Dana says it got so bad he believed he was dying. So picture a living room floor covered in documents, a man fighting for his life and still choosing to keep going. And in that confusion of illness, evidence, and anger, a name emerged, the Trail of AIDS.
I put them in chronological order. And when I put them in chronological order, the sequence of events, and I put them together, and I was livid. I said, you all knew what and when, but you didn't do anything about it. You were taking the advice of the blood banks and who produced the products, and the manufacturers who were processing and selling the products, and you all knew it was contaminated, and you didn't do anything about it. The only way they would pull them off the shelves or recall them if they could trace it back to a person who had AIDS. By that time, it's too late. It's been distributed.
This is a hard truth about advocacy. Sometimes you don't start with hope. Sometimes you start with refusal, to let silence win, to let harm disappear into a footnote, to let people who profited from delay walk away clean. And Dana's next move proves something important for all of us. Advocacy isn't one thing. It's bedside courage. It's paperwork. It's phone calls. It's showing up anyway, even when it costs you. Dana took the Trail of AIDS where it could do what support groups in private grief never could, force accountability.
I knew I had to take them, print them off, make copies of this, and give them to Senator Bob Graham of Florida, Representative Porter Goss of Florida, and Senator Ted Kennedy of Massachusetts. And I got to know them very well by just making an appointment and taking these to them and letting them know. And at that time, I also met Louise Ray, who had her sons that all had HIV. So she worked with me in convincing everybody that they needed to look at these documents. And it was surprising. I left it, I think, around December. And in January, I got a call, said, can you please come in? We want to talk to you about it. They all were appalled at what they saw. I said, our community has been crying out for a congressional investigation. And they weren't going to get one. Senator Kennedy, Senator Graham, and Porter Goss sent over the Trail of AIDS to Secretary Donna Shalala. And she, in turn, commissioned the Institute of Medicine, Academy of Sciences, to do a study. And this was in 1993. And the study took 2 years. It finished in 1995, July of 1995.
2 years. After all of this fighting, still more time will pass, during which Dana was called up by the investigation to help understand how he put this all together.
And I showed them walked them through everything, and I said, there are more documents out there. And I spent about 3 weeks doing that with them. That was my motivation was to make sense of not only my infection, but Patty's death, because no one ever told us how to prevent this. And no one made a decision in the very beginning to quarantine these products or get the news out about these products, because they were afraid at that time, especially the National Hemophilia Foundation, of associating hemophilia and AIDS. They did not want to associate it. So all I can say is that I was the catalyst of getting these documents, which started the ball rolling for not only the Institute of Medicine report coming out with 14 recommendations for blood safety, but also the Ricky Ray bill.
It's a moment like this when your splash creates a ripple. What Dana helped trigger wasn't only a report, it was a shift in what the country was willing to admit. There was a moment to blame, vindication after years of work. But there would be more. Dana's efforts would help lead in part to the Ricky Ray Hemophilia Relief Fund Act, federal legislation that created compassionate payments for eligible people with hemophilia who contracted HIV from certain blood products. It wasn't justice, but it was acknowledgement.
Yes. So I just realized that if it hadn't been for this trail of AIDS in the hemophilia community, we probably would not have had the Institute of Medicine Academy of Science report, and I know we wouldn't have gotten the Ricky Ray bill because they needed the proof that there was a reason for the government to compensate.
And beyond compensation for families affected, federal guidelines and the establishment for the very first time of the Blood Safety Council.
Number one, to assign someone who would oversee the nation's blood supply from the Department of Health and Human Services. And the second was to establish a Blood Safety Council, which then became the Advisory Committee of Blood Safety and Availability. And then there were other categories of involving the CDC with their division of blood disorders and to working collaboratively with them. And there was also who the committee would be made up of. People who were concerned with society. There would be some lawyers on it. There'd be some doctors on it. There'd be some agencies on it. And then, social workers and counselors. And then it was consumers. There'll be a consumer on it. And Donna Shalala, through one of the people in HHS, decided that they would invite me to be the first consumer to serve on the Advisory Committee of Blood Safety and Availability, and that was 1996.
The work Dana and so many others worked tirelessly to organize and uncover was only the beginning, because that inspiration lit a fire under an entire community.
Even though I may have been a catalyst, then this community joined in with us. And people started to get together. And it was everybody. The Committee of 10,000, Hemophilia Federation of America, and the National Hemophilia Foundation all working together to make things happen.
This is key to what Dana really did. He helped a community find a voice that refuses to stay hidden. Because when people stop feeling alone, they start becoming organized. And when they organize, systems change. Which brings us to why Dana is speaking with urgency now.
It wasn't until this past year where I learned that in July, a message went out through the Advisory Committee of Blood, Tissue, Safety, and Availability. The government dismantled it, and HHS didn't keep that committee anymore. And I found out about that, and shortly thereafter, I also learned that the government did a reduction in force in CDC personnel at the Division of Blood Disorders. And so those two are so important to the national safety of our blood supply. And you don't get rid of something that was overseeing the safety of your blood supply, who called to accountability many of the blood product collection companies, the manufacturers, and kept them testing what they needed to do, which they didn't do earlier, and screening, and all these policies and procedures that they did. Who is overseeing them? And when I asked that question of some people in the government, they said, well, and especially some of these industry people who are collecting blood, they said, well, we're going to make sure it's done correctly. Well, that's like someone policing themselves to not speed. There's self-interest there, and sometimes who's going to keep the check and balances? And that's when I decided we needed to get this community back into advocacy and question why and support the reinstatement and refunding of the Advisory Committee of Blood Safety and the CDC Division of Blood Disorders.
If oversight disappears, accountability weakens. And if accountability weakens, safety depends on self-policing, which history has already proven isn't enough. So Dana did what he's always done. He called the community back to work. Dana reached out to organizations doing the daily grinding, essential work of advocacy, including the Coalition for Hemophilia B, because protecting families requires a community voice where decisions are being made.
You don't want to see the government take 2 steps forward and 3 steps backwards, and that's what they're doing, cherishing the safety of the nation's blood supply. And I look at it this way, and I have to say this, not only are other people in the future going to be put in danger, but you just walked over all the graves of the people who died that I know, including, the motivation of my wife dying, to be safe. And these people who came up to D.C. to do this because it was so important. And they knew it was important because they lost loved ones because of this. And the government paid close to $1 billion in compensatory money to the community. I mean, what, didn't you learn a lesson? It's like my grandmother used to say, put your hand in the stove and get burned once. Put your hand in the stove a second time, you removed all doubt that you're a fool. They have lost perspective on what is important to the American people and the safety of the American people.
And even after all the loss, after decades of fighting, Dana tells us what gives him hope. Not a policy, not a committee, but the people.
And I was so excited to hear that Coalition B was wanting to get involved with this. And what gives me hope is seeing a younger generation getting excited about going and visiting their legislator for this cause. And I watched a number of younger people do that, getting excited about realizing that the issues of blood safety. I went with some on a Hill Day, and I watched them tell their stories, and I watched them get excited about telling their stories and excited about what their asks were in front of legislators or legislative staff. And I'm thinking, my gosh, it's happening again. I can't wait to see more advocates come about. And I'm glad that the organizations are doing this. And anything I can help these organizations, I'm doing. When I go in, I say I'm representing all of these organizations. I've been part of them all in one way or the other throughout the years. And we're still a community. And so it's just not me representing one, but there's a lot of organizations that are all involved in this. Don't give up hope. And I think if you have a cause and you know the right thing to do, and you know the truth, and you know what your community needs, pursue it, do it, and do it with hope that it's going to happen.
Dana's story began with an injury on a basketball court and became a lifelong confrontation with what happens when systems move too slowly. He turned grief into a mission. He turned documents into leverage. He turned stigma into a public truth. And now he's asking something simple of all of us. Don't forget what this cost. Don't assume safety is permanent, and don't outsource advocacy to someone else, because the ripples only last if we keep making them. Thanks for listening to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Thank you for listening to Boundless B, the Hemophilia B podcast, the podcast standing with you from a family like yours, presented by the Coalition for Hemophilia B and in partnership with Balancing Life's Issues. Produced by me, Kai. Got an idea for the show? Send us an email at podcast@hemob.org, and don't forget to stay connected to your community at hemob.org. Anything else to add, Miles?
Yeah.
This episode of Boundless B, the Hemophilia B podcast, presented by the Coalition for Hemophilia B, is made possible in part by the support of CSL. We thank CSL for their continued commitment to the bleeding disorders community.